So many people tolerate being in pain when they don't have to. Regenerative medicine is taking some really exciting turns. We have some really unique and advanced therapies that are starting to become more popular. As a physician, I thrive on being on the cutting edge, and this is a new frontier of medicine. The reason somebody might consider having a regenerative procedure done, a typical patient might have a sports injury. The other common reason people would seek this therapy would be arthritis. Most people are going to come in and seek attention when their injuries are interfering with their ability to enjoy the activity that they're doing. So if you're hesitating to, hey, am I going to go up on the mountain today to ski? I'm going to regret it when I get home tonight because I'm going to be in so much pain. That's when people are going to start investigating what opportunities are out there. People who are experiencing chronic pain are very much going to be interested in finding out what options there are to help manage that. And depending on what the etiology, what the cause of the pain is, you may be a candidate to use a regenerative therapy. There's a huge difference between stem cell therapy, PRP, exosomes, and PDPA. Let's start with PRP. PRP is platelet-rich plasma. We actually just draw your blood, spin it down, and we take off that portion of the plasma that has all of the platelets in it. We can use this in joint injections, for example. If somebody has mild arthritis, they may not need a product like PDPA yet, and PRP would be a really good first choice for them. Stem cells in the United States are very controversial. The only stem cells that are legal in the United States are those that we harvest from you, either from bone marrow or fat, and we minimally process them and then re-inject them in the same day. If you want to use something like umbilical cord stem cells, you have to go outside the country. Exosomes are a secretory part of a stem cell. The way stem cells work is they have all of these healing factors in them, these growth factors and proteins. Usually, when a stem cell goes to a site, it will release these growth factors in a packet called an exosome. And that exosome has parts of the parent stem cell. The therapy that we're really going to be discussing in a lot further detail is a new therapy called PDPA. It's Placental Derived Protein Arrays. It is just the ultra-purified proteins and growth factors. It doesn't have any DNA from like a stem cell, and it's not that envelope that the exosome has. We take stem cells from the placenta, and then we take the healing factors from those stem cells out of the stem cells themselves, and we're able to get a product that we can inject pretty much anywhere in the body to help your body heal in a natural way. So we're giving the body all of the raw ingredients that it needs to heal with. When we're young, our body makes all of these products, the proteins and the healing factors. By the time you're 18, the levels of these healing factors have gone down dramatically. So if you have osteoarthritis, for example, and there is some wear and tear injury there, you're actually wearing down the cartilage. You can go with these products and turn on the cells that repair the cartilage. So now you can actually grow back some of that cartilage. I'm not saying that we're going to be able to take someone who has, quote, bone on bone and give them a new knee, but we may be able to regrow some of the cartilage and prevent them from actually needing to have surgery in the future. There will be times where somebody may have to have surgery, and we can use this product before and after that as well. PDPA is extremely safe. When it is sourced, it's sourced ethically, and it is put through a rigorous process to make sure that it is purified and that we've removed all of the cellular products themselves. So there's no DNA, there's no cell capsule left. It's just the pure healing factors and proteins that is left. So it is very, very safe, more so than stem cells or exosomes, because both of those still have cellular products in them. And this is just the healing factors themselves. It is highly regulated, and we now have a product that is shelf stable. In other words, we don't have to keep it in a deep freeze and we worry about, did it actually come to room temperature and did it denature it? Because of the way the product is processed, it's actually in a powder form, and we don't reconstitute it until we're ready to inject it. We can administer PDPA in several ways. The most common way that we do this for injuries is direct injection where the injury is. So if you have a muscle that's torn, or if you have a joint that needs healed, we're going to inject directly into the joint or directly into that muscle or tendon. We can also apply it topically. They are using PDPA in aesthetic purposes on the skin, and it's showing a lot of promise there, although it's a little bit more expensive product than most people would want to use just as a cosmetic solution. Patients can actually notice some results almost immediately because the PDPA has a lot of anti-inflammatory properties. There are some patients who will have immediate relief of their pain within 5 minutes of the injection. But typically, most people are going to notice at least something within approximately a week. By 3 months, there is going to be the full effect that you're going to get from the product. So whatever pain relief you've gotten by 3 months is what you're going to get from the product. Typically, it can last anywhere from 6 months to a year. We wouldn't need to re-inject unless you were actually having pain again. So if you get to the year mark and you're not having pain, it wouldn't necessarily mean that you'd have to be re-injected. But depending on how severe a condition that we're dealing with, let's say you have stage 4 osteoarthritis, bone on bone, we would typically recommend that you get a series of injections. So if this is in your knee, I'm going to inject likely the PDPA product, and high hyaluronic acid, which gives us a little bit of a buffer in the knee to make it so that the bones are kind of pulled apart. And we'd recommend a series of injections, probably 2 to 3, maybe 4 injections. Once you get your series of injections, then it's going to be more maintenance. It wouldn't be that every year you would need 4 injections. We would probably do maintenance every 6 months to every year. PDPA is uniquely suited to be combined with other therapies, peptide therapies, hormonal therapy. We do use peptides like BPC-157, which is a healing peptide. That can be combined very nicely with PDPA. There's no restriction with using PDPA with any of these other therapies. It's an exciting time to be working with PDPA because we're really uncovering new areas where PDPA can be helpful. People who have autoimmune diseases, things like Crohn's disease, which is a particularly awful inflammatory bowel disease, there are case studies where using PDPA has actually healed that, and the patients are no longer requiring their regular medications. We're seeing people with sports injuries that were career-ending that are starting to use these products, and now they're able to go back and be a pro athlete again. If you have inflammatory conditions or you have tissue that's just not healing, we can use the PDPA to give your body all of the ingredients it needs to heal naturally. Your body is meant to heal. By offering PDPA to my patients, I'm able to transform their lives. And the best thing about this, it's non-surgical. The injections don't hurt. And patients who have been in pain are getting real relief. And it can happen almost immediately. This is how rapidly medicine is evolving. And it's why I love riding this wave with this new product, PDPA.